The Royal Columbian Hospital Foundation is usually busy developing donors for equipment and other needs for this large regional hospital situated here in New Westminster. While that work is ongoing, in these times of COVID-19, a lot of their efforts have shifted significantly.
My name is Jeff Norris. I'm the president and CEO of the Royal Columbian Hospital Foundation. So the role of the Royal Columbian Hospital Foundation is primarily to find support for the urgent needs of Royal Columbian Hospital. So traditionally, that's probably taken a very different format than what it has for the last few weeks. Typically, that means we're going out and working with donors over a long period of time and getting donations for different projects as it goes forward. But in the very short term, we've shifted. We're still collecting donations for different projects, but we're also very much focused on immediate needs, and a lot of that's in-kind donations that are coming into the hospital to help out. So things like food services has been massive. We've seen so much wonderful support from different restaurants locally, places like Boston Pizza or Fratella's Bakery or Brown Social House, which is just quite near to us, or Freshie, stepping forward and supplying meals for staff, which has been huge because they're, of course, working longer shifts and under different conditions. So it's wonderful that we're able to bring in food for them. Or then we've had wonderful support from places like hotels in our community. So Dead at the Key, for instance, being involved in donating rooms or bringing rooms at low cost to us that we're able to purchase for staff that, for a variety of reasons, it's more appropriate for them to stay in a hotel for a little while rather than being heading back to their homes. So our traditional role is straightforward fundraising, getting donations, but our current role is figuring out whatever we can do to support the hospital. And for the most part, that's taking the format of making sure we're taking really good care of our caregivers because they need someone looking out for them right now.
Right. So what are some of the needs of the caregivers in particular?
Yeah, so a couple of the ones that I mentioned before, we do things like arranging rides for them to get to and from work. So if you can imagine, someone's working some extended shifts as things progress, and they're going to be tired. We don't want them jumping on the road back and forth. So we have a program to support them that way. We have accommodations that we're able to support caregivers if they've maybe had some sort of exposure to COVID and they're not comfortable going back to their home because they've got their families there. We've got places for them to stay that are involved with it. We're bringing food in multiple times a day, breakfast, lunch, dinner, coffee, pizzas coming through, pasta dinners coming through, and those sorts of things so that they can't access the restaurants the way they normally would have in normal working days. And we need to make sure they're getting fed and taken care of. And then another really cool program, and it's making a big difference and people are really appreciating it, on our website is people can log on and just send a general message of support to the frontline caregivers. And we've got ways within the hospital, TVs and other bits of media that we're able to transmit those messages to folks. And it's really, really well received in terms of our frontline caregivers knowing that there's people in the community sort of thinking about them and really applauding the work they're doing. So we're happy to support them in that way.
I put mine on there.
Good for you. That's awesome.
Have you been hearing pots being banged and so on? Near the hospital?
Well, I think sometimes the sirens drowned out the pots, but yeah, you definitely hear the pots going on. It's such a cool thing at 7:00 for that to happen, and people have been regularly taping it from outside the hospital as well, like videoing it and then sharing it inside the hospital with staff. And people think it's so cool. I mean, all those things. I mean, we're talking about some of the stuff around just tangible donations in terms of giving an item or giving money to it, but giving the moral support in terms of just sending your comments through, send a video through. We're collecting those to share with people. We've got kids sending drawings through that we can share around with people. I mean, all those things are just really important for the frontline caregivers who are working very hard under different conditions, under more stressful conditions than they would normally face, and they normally face very stressful conditions in hospitals. It's so great for them to see those little glimpses of the outside world showing their support for them.
That's great. So now tell me, how would you go about sending a video? or a picture to you?
Yeah. So again, I'll drive people back to the website because we have contact information there of how to send videos or send pictures through, and then we've got a team of folks that are making sure to move those into the right format and able to share them within the site. So yeah, everything back to our website. We're happy to move it through, and frankly, even if it's not necessarily something we're looking for, send it through, and we'll make sure that. It gets to the right place and it gets considered the right way. We're helping make sure that offers get to other hospitals and all those sorts of things as well.
Is there other needs aside from the food for the people working and places to stay? Is there other needs, and how can the community help fulfill those needs?
For sure. So one of the needs you've probably heard is PPE, or personal protection equipment. So it's things like goggles, masks, gowns, gloves. So we've got a full listing up our webpage with real specifics. And sometimes, as it turns out, there's people that have these either in their business or in their homes for some reason. So for instance, some of the face masks that we use would be the same things that someone who does drywalling would actually use. And so people wouldn't think of those kinds of things right away. But if people have those, they can contact us, and then we arrange either for pickup or for it to be dropped off. And then that gets into the main stockpile that's getting out to frontline caregivers. There's also some minor pieces of equipment that are helpful in the COVID response. And so we have folks bringing forward with cash donations so that we're able to go out and purchase those from the medical community. So those are some really big and impactful areas that people can also support. But something I think everyone appreciates as we go through responding to this is needs evolve every day. So if we're talking this morning, I might have a different list of needs than I would have tomorrow morning. So I do really encourage people to reach out and make sure that if they have some level of support that they want to give, to contact us, because we might not need it exactly this moment, but as we look into it, we might need it a little bit down the road.
So in other words, people should touch base with your site on a regular basis to see if there's any needs that they can specifically help.
Yeah, by all means. And it's been, and I gotta say it again, it's been really quite incredible to see how much the community comes together, and how willing people are to step forward and make sure our frontline caregivers have what we need. And I'm really fortunate in that I'm getting to spend a fair amount of time at the hospital, or getting to be there when those donations are turned over. And I got to say, the frontline folks are just so thankful to know that the community's behind them, and you see people really get a lift out of it. So I do want people to know you're probably not physically going to be coming into the hospital and bringing these different things to folks, but you do need to know that the message is getting through to them, that the community's behind them, the community supports them, and they're ever so grateful for it.
Have you been able to get protective equipment from the community? Has there been anything in the community?
Yeah, there's been a fair amount that's come through. It's it's surprising, places you just you didn't think of, estheticians and tattoo shops, and of course dentists, you would think of that, veterinarians, and as I mentioned before, like folks from the construction industry. So it's just a broad range of places that you would have never imagined there'd be this protective equipment out there have stepped forward and said, hey, we've got this or we've got that. And in some cases it's a box of 10 pieces, and in some cases it's crates of 50,000 pieces, right? So it ranges right across the spectrum from it, but all of it's greatly appreciated, and it goes through the proper protocols to make sure it's safe and proper to be used, and it's going to get deployed in the right place, and there's a good centralized process to make sure it's getting to the frontline workers where they need it. So absolutely, we're definitely seeing those kinds of physical donations coming through, and our phone lines are open, as they say. If there's more out there, that we're happy to connect and make sure that it gets to the right place.
How has it affected the foundation itself? For example, do the people who are delivering food, do they access you first and then you figure a way to get the food in? Or
yeah, that's absolutely right. So in the foundation itself, like many businesses, because the foundation itself doesn't fall as an essential service, so we closed our physical office down. It's actually being used for other things within the hospital. But our foundation employees keep working in terms of going out and finding cash donations to pay for these different services, finding in-kind donations of the services themselves. And so we're working as the conduit to the hospital to supply these sorts of things. So either reaching out through our webpage is a great means of people getting in contact with us. There's lots of details on the types of donations that are coming in and how to talk to folks. And then we coordinate with the different vendors and make sure we figure out the right time, right place. And there's different procedures. For instance, say if they're donating food, it's important that they're individually packaged and, all these kinds of elements. So we'll work with them to make sure that things are handled in the right way for what's required, and then we coordinate and bring those in. And we've been so fortunate, when you talk about food vendors, we're able to, I think this week we're serving meals there 7 days a week, and so that we've got enough interest from the community to be involved in that we're able to keep those kinds of programs going in a very robust way.
Yeah, that's fantastic. So has there been a number of extra staff that's been brought in for the crisis that has increased the need as well?
Well, not at this stage. As things progress, you'll see staff getting shifted around and moved to where they're needed. There's lots of really strong long-term planning that's gone on within the healthcare system to make sure that the people that are needed are in the places that they're needed. But you've probably seen on the press, there's been activities to curtail some of the normal work that a hospital would do. So things like elective surgery, for instance, got reduced down over the last couple of weeks and moved to just required procedures going forward. So it actually means that we've been able to gain capacity to be able to meet the needs of this if and when it progresses.
What do you suggest people do? Should they just access your website to find out what is needed, or
Yeah, the website's the best source of information, so rchfoundation.com. If they log on to that, you'll see right away it talks about sort of 3 streams of support that can happen, whether it's donating product, in-kind sorts of things, whether it's putting your message in front of caregivers, or whether you want to do cash donation. And then if you're clicking through any of those, we've got folks that'll follow up with folks right away and talk to them about the best ways to get that donation in and to be able to help the frontline caregivers. And even if it's something that I haven't mentioned yet in terms of going through this, we're really amazed at sort of the creativity of folks reaching out to us and saying, hey, do you need this? Fill in the blank, and it might have not been something we've listed, and we look at it and go, yeah, you know what, that's actually going to be really useful in the system. So I encourage people not to be constrained by just what we have listed out there as our current needs, but if they have something else, a service that maybe we even haven't thought of yet to bring forward, it'd be something really useful. So great, crazy example, and I shouldn't say crazy, but quite interesting when we're worrying about social distancing and how how we interact with patients on site. Some of the things that we traditionally done, which would have a lot of physical contact and constantly going into rooms, have to be curtailed. So right now there's a need, for instance, to bring baby monitors onto the site so that there could be some more remote monitoring of patients done within the place. So you'll see those sorts of things pop up, and they're different than maybe you'd expect, but it's a real tangible way that the community can help us out in the hospital.
And what about the ability for people to communicate the patients to communicate outside of the hospital? I would imagine there's maybe need for iPads or, phones, that kind of thing.
You nailed it. You nailed it. Absolutely. So we do have a number of iPads that have already been donated coming into the site, and it's being used exactly as you describe it, for communication between patients and people outside the hospital, because of course there's visitor restrictions in there right now, and we are continuing to receive and accept those, and then we go through and make sure that they're set up the proper way, and then we put them into use within the hospital. So good on you for being creative and suggesting something I haven't suggested yet.
I think that I've probably heard about something like that on television with regard to, the seniors and senior retirement homes and so on.
Yeah, and now you're seeing it in that place too. And I would encourage, and I know there are lots of people watching this program, and I'm talking specifically about Royal Columbian, but the whole system needs support. So if you're in another community and you hear this, don't be afraid to reach out to that site as well. Or, of course, as things are coming into the different hospitals, if we've got more than what we need, it's being centralized and making sure it's being distributed out to where it's actually needed. So it's definitely a system-wide effort to make sure our caregivers get the support they need.
Now, Royal Columbian Hospital is one of the bigger hospitals.
Yeah, that's correct. So within Fraser Health, there's community hospitals and regional hospitals. And so Royal Columbian, Abbotsford, and Surrey Memorial would be the regional hospitals. So the larger hospitals, and larger is kind of an interesting way to describe it, but the hospitals that are taking on more complex care than other hospitals. So for instance, Royal Columbian, we're the only neurosurgery center in the Fraser Health region. We're the only cardiac center. We're the only level 1 trauma center. So we've got some real specialties. We're the only hospital that can handle those kinds of cases, and that continues in the time of COVID. In that we're still the only hospital that can handle those cases, whether they're COVID positive or not. So that work absolutely goes forward.
Now, I don't know whether this is an area you can speak to, but my understanding is that there's some portion of a building, a new building that's going to be used for, if there's a surplus of patients.
Yeah, I can speak to it briefly. So it was interesting kind of timing of everything going on. Royal Columbian's going through a $1.5 billion expansion right now. So massive expansion, one of the biggest expansions in Western Canadian history in terms of the hospital. And it was divided into 3 phases. And phase 1 is a new mental health tower, 75-bed tower, and that's almost complete. It was actually set to open up this month in April. But as it hasn't opened up at this stage, it's certainly been remarked by many of the health officials that they've put a circle around that to say, okay, if we need to expand and have added capacity within the system, this new building would be a good fit for it. Now, it's not something that's happening immediately, but it's something in the long-term planning, if and when it's needed, that's we have access to that building. So it's nice. We've got some added resources on the site that literally just came on stream this month that could be used for some of the response if it's needed.
Uh-huh. Any particular concerns if this issue goes on and on? Like, is it for the foundation?
Not immediately. I mean, I think like everybody, I don't have a crystal ball to predict the future of what things look like. But our history, we go back 45 years as a foundation. In fact, we go back about 150 years of fundraising. I don't think everyone completely realizes it, but Royal Columbian, when it was built 155 years ago, don't quote me on that exact number, but I think I'm pretty close within a year. 155 years ago, it was because the community came together and pooled support. It was a little over $3,000 of support they pooled together to get the hospital built. So, the community coming together to give their support to the hospital is like in our DNA. It's part of tradition of the place. It may look different 6 months from now than it did 6 months previous, but I'm quite confident we'll still be doing it as we go forward.
I often buy stuff from the RCH store.
Yes.
Especially when a baby comes along, because you get these amazing little knit things. Yeah. So what is the store? Is the store online or?
I'll look into that because I don't think they are right now, and it's probably something we can help them out with as it goes forward. Just in terms of, within the hospital, wouldn't have been appropriate to keep the store open in this time. So I know the store is closed down, and I don't know if they have an online portal for it. But it's something we will check into, and if we can help them make sure that they get their goods out to anyone interested right now, we certainly would do that. Yeah,
because it's such a great resource for baby clothes and gowns,
and it's wonderful. And you talk about this 155-year tradition. That tradition goes back to auxiliary, our volunteers that have been around the hospital for all that period of time, and different groups and different formats. And that store is run by those volunteers, and they do incredible work. So thanks for shouting them out and talking about the support that we can give to a store like that.
Yeah. And so do they relate to you as the foundation, as a foundation? Or
so they're a separate group. They're formed on their own side, but we work closely with them on a bunch of projects. Okay. And we work with them. A lot of the funds that they raise through that store go to the purchase of equipment. So we'd be involved with working with them like that. They're one of the great benefits we have in our role is being able to work with the wonderful people that step forward in the auxiliary.
So any last message you want to get out there?
Well, I think it's the same message everyone's passing out there, and our frontline workers are really banging the drum and making sure people are reminded. Physical distancing is huge right now. What we can do to stop the curve of this and expose less people to it over a short period of time really helps the frontline caregivers. So physical distancing, super important. Stay 6 feet away is what we always talk about. Wash your hands really, really well. Practice those practices, and then make sure that you're staying home unless it's absolutely necessary to go out. So that is one of the biggest things we can do as a community to help our frontline workers. And so it's always good to remind people about that, even though they've probably heard it multiple times right now. We want them to know that again.
Uh-huh. Well, terrific. Thank you so much.
Thanks so much for taking the time and everything you do, and stay healthy and stay safe.
Okay, you too. Thanks so much.
Take care.
Okay, bye-bye.
Bye-bye.